Thank you, Madam President. So, blood banks and hospitals have facilitated autologous and directed blood donations in the past when they were deemed medically necessary by a physician. But this legislation says if you're going to have a procedure that blood might be necessary, you might need a transfusion, you can request this for any reason that you feel like. No explanation needed. And I listened to our blood banks who are registered as opposed to this legislation, that it takes 48 hours for them to process blood, to test it, to manage it, to store it. There are a lot of resources that go into making sure our blood supply is safe and it's stored appropriately and it gets to the people who need it. There are a lot of concerns from physicians, the Iowa Medical Society, and our blood banks about safety for the patient and what this could do, how it could negatively impact safety. Because this bill allows for an individual to ask a family member, will you donate for me? So then this person feels pressure to make sure that they can donate. I want you to donate. And so everyone in the community who donates blood goes through a screening process, and they need to answer, honestly, difficult questions about their personal behavior. And if someone is feeling pressured that they need to come through for their family member, there is the potential to lie on those questions. If you have a history of IV drug use that you don't want anyone to know about, if you have some behaviors that put you at greater risk, but you don't want your family to understand, you don't want to have to explain that you can't give because of that reason. And blood banks have found that when somebody is pressured to give donations, they are more likely to end up in screening having blood that cannot be transfused because of risks that are found in the screening. There's also an increased risk of graft versus host disease when you have a close relation giving blood to you. And it also sets up the possibility that your family members might not be able to give you transplants in the future. And we know that bone marrow donations and other kinds of transplants may be necessary in a person's life, and we don't want to end up putting them in a situation in the future where their possible donors are no longer eligible to donate and save their life. So there are actual risks in facilitating these blood donations when they are not medically necessary. And the blood banks have also told us that our general blood supply is already stressed. Blood banks do not have the resources available to manage, store, test, administer private blood supplies for anyone who feels like it. There's a potential for an increased cost for health care for all Iowans in order to manage and provide this service. I'm just asking my colleagues to listen to the folks who do this work, to really listen and understand. You know, we're going to hear, oh, hospitals and blood banks used to do this all the time. That's not really true. It's just a perception that's been shared. And our understanding of bloodborne pathogens and infection control risk, those things have transformed in the last 20 and 30 years. And there are real medical reasons, real important reasons why this will be harmful to health care in Iowa. So I ask my colleagues to vote no.